don't have a choice. I don't think that's the thing people realise. You don't have a choice. This is not optional.
I think it dehumanises you because you feel that you're not valued, that, you know, nobody thinks, oh, she might need a day off, she might need time away.
It's one of the most physically and mentally draining jobs anyone can take on. And at times, it can also be one of the most thankless. Right now, there are more unpaid carers in Scotland than ever before, and it's not known where our country's most vulnerable would be without them.
If carers were to say, I can't do this anymore, I honestly believe that the NHS and social care system would crumble.
2 years ago, Margaret Grass was diagnosed with terminal bowel cancer. Her daughter Julie now cares for her 7 days a week, 24 hours a day.
She can't do anything now for herself. She's housebound, she's bedbound, she's not mobile.
Julie says her mother's discharge from hospital was terrible and that she was given no other choice than to immediately become her carer.
There was no communication before Mum came home. I actually, about a week later, I phoned her consultant and said, look, nobody's spoken to the family, nobody's sort of said anything. And he said, well, actually, we told your mum. Now, my mum was 88, my mum had no idea. And it was myself that mentioned to Mum that she had cancer. And her head nearly spun off her shoulders and she said, who's got cancer? I asked on the phone, could you please send me instructions? How do I manage, you know, this type of cancer? There was nothing, absolutely nothing.
Across 15 hours, Julie dresses, washes, feeds and medicates Margaret. And that's only the beginning.
After maybe a year, Mum got catheterised. Things like, you know, managing, changing her leg bag every week, managing her night bags, emptying the drainage bags properly. I have said this to Mum so many times, I don't know how people out there do it.
Margaret's health fluctuates so often. The risk of a crisis emerging is incredibly high. It means Julie can hardly leave the house, and when she's in another room, she has to keep an eye on the baby monitor.
Not only does your loved one become housebound, so do you. You don't socialise much. You know, you could never leave her on her own. So you're very much isolated from doing things that you perhaps did. Also, I worked before this, so you had an outlet. That was even a social outlet. I stopped working to provide care to Mum. I qualify for £69 a week, and that's basically it.
Caring has also meant that Julie's own health has been forced to take a back seat.
What if you had to, say, go into hospital? What happens there?
So you can't have a day in bed, you can't have a day out and be sick. I had to have an endoscopy, and I took it under local anaesthetic because I had no respite. I had nobody to care for Mum while I was having that procedure. If I'd had it under sedation for 24 hours, I wouldn't have been able to work the hoist. I wouldn't have been able to give Mum her medications because myself, should be supervised in that time.
Julie's situation is not uncommon. A quarter of carers told Carers Scotland that their home and day services have reduced over the past year, meaning they struggle to access health services themselves. We also know that half of Scotland's carers have been waiting for more than 6 months or more for specialist treatment or assessments.
If we can't support carers now, their mental health and their physical health will be impacted to the point where they cannot continue to provide a caring role, and that will have a huge financial impact on the NHS.
Alison Wright is the CEO of Carers of West Lothian, a charity that supports unpaid carers.
In West Lothian, we estimate there's around about 20,000 unpaid carers. We're supporting around about 7,000 adult carers and around about 400 young carers from the age of 8 upwards. So we're not reaching all of them. They are hidden, they are carrying on, they're coping at home, they're getting on with it.
Alison says since the start of the pandemic, there has been a huge surge in the number of people becoming carers. She puts this down to long COVID and families being asked to provide care for loved ones to ease pressure on the NHS.
More carers are providing medication, more carers are doing personal care than perhaps previously. The number of hours that people are caring has increased as well.
A third of carers say they have not had a break from caring within the last year.
Care packages aren't as available as they were because care providers are not able to put as many people into homes as they used to be able to, and that is also having an impact on families and carers because they're having to do all of that themselves. They are not really appreciated for what they do, and this is where we need to try to step in and reach them at an earlier stage and provide them with the support that they need.
Nikki Foley has been caring for her two sons, Logan and Kieran, for almost 3 decades. They have a range of neurological conditions such as autism, ADHD, Tourette's and epilepsy.
It's like, I guess, being a doctor and being on call 24/7. It's just all the time. You just don't stop. I can't remember the last time I got a straight, 6 hours sleep. It's normally always interrupted and I'm up during the night.
Like Julie, one of the biggest struggles for Nikki is the lack of respite.
When my mum died and stuff and I had nobody, that is when I just thought, I literally can't do it. How am I going to do this without my mum? Because she was the only way I got a break, only way I got respite, and I just thought, I'm not going to ever have a break now. This is it forever. And yeah, I mean, I've had a breakdown as well myself in the past because of it, because I just literally was ill and I knew I was ill and I couldn't stop caring. I didn't have that option. And I've literally had vertigo and been on my hands and knees to make food and look after people because I couldn't stand up. I was too dizzy to stand up. So I literally had to crawl about the house to get everything done that needed done.
What's changed over the 27 years you've been doing this? Has anything changed?
Not much. It's pretty much been the same, and I know tons of other carers that say the same and that are struggling and that just can't get help.
Have you almost given up asking for help to an extent?
I absolutely have given up asking for help, yeah.
Carers need a break emotionally, financially and physically, and Carers Scotland want to see them receive an immediate winter top-up payment to help them cope over the coming months.
Carers out there are doing this for £69 a week, and at the end of the day they're saving the country over 10.8 billion. How can their voices be heard? They can't go on strike, they don't have a union.
If you were in charge for a day, if we gave you the keys to power, what would you change for carers?
I'd get them recognised as people that do this incredibly difficult job. I mean, it's insane, the fact that they've got no respite, the fact that you're kind of expected to do it because it's your relative.
But while they wait for help, Nikki, Julie and carers across Scotland will continue to put all their love into caring for those closest to them.
I wouldn't wish this kind of life on people because it's difficult, but at the same time it's rewarding, and and I love my kids and I wouldn't want to be doing anything else. So I think you've got to kind of accept your life for what it is.
You're feeling good?
I'm feeling good
Today?
today.
Oh, that's good. Do you know why that's good?
No.
Because it's my birthday.
Oh, that's right.
I do worry about the future. I don't know what to think. I can't imagine what it'll be like without Mum. And what age am I? Well, look. No.
I can't get it.
21. What will it be like going into that room and she's not there? What will it be like, just your day-to-day being filled with Mum? What will that be like when it's gone? I have no idea.